In the next edition of It's About Money, my guest will be Joshua Fallon. He's a physical therapist, a doctor of physical therapy, and he'll be talking to us about the career of physical therapy and what's involved in it. Stay tuned for the next edition of It's About Money. Hello and welcome to another edition of It's About Money. I'm Nanette Nocon and thank you for joining us. I am thrilled today to have a guest. My guest is Joshua Fallon, who is a physical therapist, has a doctorate in physical therapy. We're excited to have him because he's so enthusiastic about his career and does a terrific job. So I wanted to interview him to talk about that aspect of making money, being a physical therapist. Joshua, welcome to the program.
Hi, thanks. Glad to be here.
So, how did you decide to become a physical therapy? How did it all begin?
Well, I went to Cuca College in my freshman year, and part of their program is a clinical internship. They call it a field period, and you had to choose a place to check out, I guess, and explore because I was there for biology, and they did not have physical therapy at Cuca, but one of my friends, Doug Keller, his mother, Bonnie, was a PT at the Highlands of Pittsford, and I chose to do my field period over there, and just very inspiring. So uh, ultimately ended up transferring out of Cuca to do that. But that's where it all kind of started.
And you went to UB, right? University of
Yeah.
SUNY Buffalo. And tell us about the number of years that you go to school as a physical therapist.
So it's a 6-year clinical doctorate, and the track is basically if you'd like to finish the exercise science bachelor's, you can. And then after that, people would specialize. Some of my colleagues went on to be, medical doctors and actually OTs and other rehab professionals. But basically, if you didn't do the 4-year degree and you wanted to do the fast track, you could do 3 years in undergraduate exercise science and kinesiology, and then 3 years at the graduate level. And then you'd be out and practicing shortly thereafter.
That's great. And then when you work in the field, you have some options of being clinical at location, right? Or doing what you're doing. So tell us about the difference.
Right. So it's interesting. There's pediatrics and geriatrics and all these sub levels, and then where you choose to practice is also option. There's options. You've got um, home health, which is what I do. I've worked in clinics, but home health is very unique in that you get these interesting perspectives from inside the patient's homes. And my patients, because I'm not in the pediatric realm, are typically 18 and up to now. The oldest patient I've had was 102,
Mm.
still living in their residential home in Rochester in the South Wedge, which is very fascinating. And you get all sorts of different, you know, opportunities to see people, whether that was elective surgery or maybe things they didn't plan on, car crashes, etc. So really, it's quite a wide range, and you have to be kind of prepared because you don't really know what you're going to be getting necessarily.
Because
Um,
it's in people's homes. Not too many people would choose that, but you
right,
do.
right. And I think there's challenges that come with it, but I think that the benefits outweigh, some of those uh, the stigma, I guess, because there's a lot of people that elect to choose to be in a clinic because it's controlled and there's everything you need is right at your fingertips. But I think the flexibility that this job offers and the unique perspective being in the homes is well worth it.
So in your job, you experienced many different challenges. What made you decide that this is what because I know you love what you do. You're passionate about it, and that's why I was excited to have you as a guest in the show. What makes you wanted to be a physical therapist, and what makes you love your job every day?
I think what it comes down to, at least as far as the home health sector, is that patients really they want nothing more than to be home after a difficult hospital stay. In outpatient clinics and other clinic settings, that typically that's a choice they make to go to those clinics. Home health is kind of this bargaining chip. The hospital says, look, you're going to go home possibly a little earlier, but we have an extension of the hospital and you are home care. And essentially they're going to come out and make it so that you make a safe transition home. And that's where the real healing begins, both emotional and physical. the patients tend to be honest and open in that setting, and they have skin in the game as well because for some of them, it's a higher level of care if they can't, make that jump. And obviously, people that have been in their homes for some of them 40, 50 years, they don't want to give that up. And it's rewarding for us to be able to provide that opportunity to them, to give them, empower them with options, strengthening and balance training that allows them to stay there longer. And when they achieve that, it's really rewarding. So
And I think, in my observation, I think that the population has a healthier lifestyle as they get older because physical therapy helps them overcome those physical challenges that normally they would be walking around with a cane or they're sort of homebound, etc. Is that a fair statement to say?
yeah, it's quality of life ultimately. When people ask me what do I do, and we had actually a professor at the university almost 10 years ago. I can't believe it. This May it will be 10 years out in practice, but they had us sum up our what we do in one statement, and essentially it's a pursuit of a better quality of life, physically, and then obviously there's a psychosomatic dynamic as well. Your mind tells your body what to do, and if you perceive your own physical wellness and it allows you to be independent, I think that that's limitless for these patients, and they start to kind of feel that, right, and the value that brings. And it's almost, even the insurance companies and the medical doctors during the pandemic, when it was really bad there, they were looking to us because we were still going in the homes. There was no exception made. We still went in full gear, um, doing what we do. And for some of those patients that did have COVID, it allowed them to stay there, and instead of being put into a subacute nursing facility or a higher level care.
I
So
see.
it's very rewarding, and I think that the medical community is starting to look at it and as being a really cost effective option, and it's the
And
way of the
uh,
future.
And the insurance companies, you mentioned that this is part of their care, so there's some allotment given for physical therapy after hospitalization in many cases, right? Do you find that there are many people who opt for additional physical therapy beyond what the insurance covers?
Definitely, and actually, I've what's happened is, some of my patients are in congregate living situations like assisted living facilities and independent living facilities. And what we're finding is that the model is shifting. A lot of those patients that were homebound or struggling to get out to appointments, especially here in Western New York, when there's snow on the ground, they want to go to outpatient physical therapy, but they can't. And that's typically where we refer them, or the family members are back at work and they don't have the time to bring them. And so there's actually companies that are coming into our area, Fox Physical Therapy, Select Life Rehab. There's a few. Stern, I believe, is out of Buffalo. But what they've done is they come into these clinics or these assisted living facilities, and they sort of establish these uh, kind of, they're like clinics, but they do it through like a PO box, and they set up in there and provide that option for those patients, and they bill it through outpatient. And then those companies are also saying to therapists that want to work there, you can also have community-based patients as well. So it is shifting towards a more mobile model.
Hmm.
I think that people are electing to do it because they do see the value in it, and um, both the insurance companies and the patients perceive value.
Right. In the challenging times these days when it's hard to get people to work in the nursing home, they have a shortage of staff that being able to stay at home or in the uh, like community, like as independent living and stuff, that physical therapists like you could still come in and continue the care that they
Exactly.
need.
Yep, exactly. It's just shifting that way. And for what it's worth, in the past there were always visiting physicians. They'd come in with their leather briefcase and their stethoscope and their white coat and visit people in their homes. And somewhere along the line, these large clinic operations, which are necessary to an extent, it just it drives the insurance rates up. And so, how do we provide cost effective care, in a way that maybe mimics that what we used to have? And I think they're realizing that this is the way to go. It's working.
Sure. Well, that's terrific. What would you say is the most challenging aspect of your job?
Well, Probably the most challenging thing that I can think of is the difficulty of the unknown. You don't really have, in a clinic setting, you may have a better idea of what's coming. In home health, it's random, right? Like whoever's being discharged, they'll come out, and we don't really get a lot of warning. So there's this large variability in the diagnoses that come out. Um, and so some of them are predictable, some of them are elective surgery, but some are more challenging terminal diagnoses. And I think just dealing with the pain and suffering, both for the patients and the families, can be tricky. And observing what they have to endure is hard. And really facing the facts that not all the patients that come in there are going to get better. That is a big difference. I know when I started here, one of my previous managers said, this isn't the 18-year-old that came in with an ankle sprain playing football. These are people that could potentially have, palliative care or hospice care on the horizon, and being able to have those talks and refer out and know who your contacts are. That's another large challenge, is knowing when you are no longer able to help that person, who do I then send them to? And, organizing your contacts, specialists, that's challenging. So you just have to kind of prepare yourself mentally for anything and everything. And, that also leads to positive things as well. You meet people like colleagues that and that mutual colleagues of ours. You meet these people, and it connects you to Rochester and makes it a small town feel smaller, which is rewarding. But you just don't know what's coming. And I know when my father was ill, he had our services, and it really kind of tied it together for me. Like, for him as a patient, he got to see what I do, and then conversely, I got to be on the receiving side of the care as a caregiver, and it just really that's challenging. I can tell you now that I've seen both sides. It's not easy, but
Hmm, that's great. What would you advise to somebody who's thinking about a career as a physical therapist?
I think that keeping your options open. I think if you've locked in and you think you're going to take on the challenge, it's very rewarding. You just have to find your calling within the scope of physical therapy, because I mean, there's aquatics and geriatrics, and in fact, I considered hand therapy for a long time, and the schooling was, I think it was another 2,000 hours beyond the doctorate to become a certified hand therapist. And I followed a CHT for 12 weeks, and she said, if this is something you want to pursue now, feel free, but you can always specialize. And so just keeping your options open within the realm of physical therapy, and just being kind of ready for all opportunities. It's critical. And but you'll find that it's rewarding in any of those. Um,
Thank you, Joshua. Time went by so quickly. I want to thank you for sharing with our viewers what it's like to be a physical therapy, and really enjoyed hearing about those various aspects of the career. So I wish you very well wishes, and hope to talk to you sometime soon. And thank you, our viewers, for joining us today. Again, thank you, Joshua. And until next time, our viewers, it's Nanette Nokan. It's about money.